Thank you so much. And thank you everyone for being part of this with me. So my name's Emilios Lemoniatis. I'm a child psychiatrist, a consultant child psychiatrist, and I'm also a digital innovator and a digital lead in a mental health care trust. And this is creativity and dancing is a subject that's very close to my heart. And what we're going to be talking about, and Becky, I was thinking we were going to talk about it together, and you were going to kind of draw some of this stuff out of me, was about how about my own personal health journey recently, which I'm still going through, to be honest with you, and to be frank with people. I don't necessarily want to focus on the detail of my conditions and stuff, but I'll share. I want to share, and I want to share the learning of a psychiatrist going through the healthcare system, and essentially, I'm still off sick technically. So I had cancer. I found out I had cancer last year and needed to get treated, and I'm still going through treatment and stuff now. And I'm here as part of an educational process to kind of share learning and also hear from people what they think and see if some of this experience could go anywhere in any shape or form.
Yes.
And also in the spirit of true creativity, I haven't prepared anything specific, right? So and that's because I truly believe that creativity is about taking risks. Okay. And if there's one thing that I want to kind of demonstrate is the risk of doing something live and real and in the moment. And sometimes that requires taking a position and holding onto that position. And we can talk about Gareth Southgate and football and other kind of risks as well. We won't go there, but I think that's kind of key in our minds and my mind at the moment as well.
Awesome. I love being in the moment. This is my kind of space. So when we previously spoke, like we've been talking about dance and creativity, but language, going back to like our first session was all about words as medicine, or using language to like get things done or make connections. How did language come to play, given your expertise of the NHS, psychiatry, all of these things? How did you use your language going through the healthcare system, and the good and the bad?
Wow, that is a key issue and situation, and I think just to kind of help people understand a little bit where I come from as someone who works with other people, whether I'm a mental health professional or not or whatever, or just fundamentally as a person. Something that I truly believe in is, and has influenced my practice, are two things really. And one of those things is about really listening to people and listening and understanding what someone is saying, and to understand what their perspective is. It's not necessarily the thing that they're saying, it's why they are saying that thing. And it could be about the thing, but fundamentally is, why are they saying that? Why do they believe this? And I've really put that at the center of the way I work clinically. There's a professional term for it. We call it epistemic justice. And it kind of changed my practice as soon as I came across it. And there's lots been written about it. But fundamentally, it is about valuing other people as the knower of their own experience. Why do they say this? Why are they knowing and coming to you with a problem saying, this is my problem? And I think the other thing is about shared decision making, right? And this is something that I've worked with, that I've had training on deeply, that I've used in a very what I would call almost extreme way, of really going to long, strong efforts to make sure that people are making decisions based on their choice as opposed to my choice. And fundamentally, that shows itself when someone says, "Oh, doctor, you know best. You decide what medication I should start on, or you choose for me what care pathway I'm going to go down." I'm like, no, we're gonna sit here for a half an hour to an hour going through the different choices to make sure that you are really engaged in what we're doing, that you know that this is why we're going in this direction, what's happening to you, and what you're going to be going through. And I suppose for me, Becky, it was going into the healthcare setting,
Yeah.
knowing I had quite an acute problem that needed dealing with, and kind of looking out for these kinds of markers, right, in the way I was being managed and treated.
Yeah.
And um, uh, sometimes I felt listened to, and sometimes I felt not listened to. And I think that's a very difficult position to be in. And I think it's a very difficult position to be in when um, when you are not a healthcare professional and you don't know the language. And sorry, my camera's just turned on.
Sorry.
And you don't know what's going on in the world of health and mental health or any other healthcare kind of context. And so, yeah, it's been a journey that's made me really open my eyes wide. And obviously, there's questions about the state of the NHS and
Sure.
the funding that it's receiving and the resources around it and all that kind of stuff. But fundamentally, I think it is about people being gateways to receiving care, to receiving treatment, to receiving assessments, um, and you know, you have to provide information in a particular way for that gateway to be opened and to be opened to you in a particular time frame as well. And there are also situations where people have made decisions, where clinicians have made decisions, and further down the line there have been uh, computer says no situations. So computer has said no, that test is not okay or valid right now, and that test, let's say it was a blood test that was taken, has not been carried out because the computer at the end of the decision-making tree, that computer may have been a computer, that computer may have been a person, I don't know, decided that something was not going to happen, which is just as fundamental as certain things happening, or you're expecting them to happen. And so it's been frustrating. It's been incredible, and to be honest with you, I'm really grateful, really deeply in my body and in my soul to be here, alive and happy today, to be here to share this, because last week I don't know what it would have been like if we'd done this last week. I was in a very different state of mind, and I'm taking every day as it comes. And so that's partly also why I want this message to kind of get across, because it's I think this is the fundamental message number one, right? Number one, if you think that there is something wrong with you, you need to really hold on to that belief and make sure other people hear what you say. And that is message number one. And if that means going to your GP or your healthcare practitioner or your mental health person over and over and again, and phoning and speaking to their administrator if you're not got an appointment or whatever, you believe that there is a problem and it is causing you distress, try and get that sorted and hold on to your own belief, whatever the system around you is telling you. That's my main number one way learning from this.
That is,
and I think, Becky,
profound.
it's gone.
No, it's
I think
that's profound.
It is. It's just because there are so many factors that prevent us from seeking health in the first place, and it feels like the way our system is designed, I'm going to say in the UK, it's about illness. It's not about health maintenance, and that's right. And that is a fundamental issue. And I'll give you an example, right? A young person said to me the other day, and a young 19-year-old, fit young 19-year-old said to me, they said to me, where can I go and find out how healthy I am and what I need to do to maintain my health throughout my life, right? I'm about to go off into the world, you know, I'm 19. Where in the NHS can I go and be, you know, speak to somebody about how I can be healthy and stay healthy throughout the rest of my life? And I'm like, dude, in the NHS, there ain't no place, there is no place like that, right? There is no place where a young person can go just to have an assessment, right? A physical health MOT, top to toe review, and for someone to say, oh, you know, your thing, your genetics, your family, your or your weight, or your size, or your stature, or the kind of stuff you eat, you know,
Yeah.
take a look. You might want to have a look at that, or your drinking, or maybe you need to do a bit more dancing, dude. Maybe you guys, you know, you need to do a bit more dancing, and also maybe your family, your younger brothers and sisters might need to do a bit. There's nothing like that. And so when you're encountering it from a health problem perspective, it almost feels as if you have to prove that there's a problem, right? As the patient coming in, right? I have to prove that I've got a problem. I have to prove, and the level, right? The bar of proof, it feels like I'm in court, right? Sometimes.
Yeah.
Not just I'm really worried about this. I've got some symptoms. You know, it's like, do you have all the symptoms?
Yeah.
Like, in order to get a referral to a specialist, right? It's not just some symptoms; it's all the symptoms. And if you've got some symptoms
Yeah.
from perhaps another disorder, right? And we're talking about complexity now, so there are layers of different conditions. Oh my gosh, that creates a whole other level of problem for the listeners of our story. And I must admit, I've had situations which have been amazing as well, right? I've had situations where people have taken their time to listen to me and have gone through some things with a fine tooth comb, and we've been able to spend time. But those situations have been fewer and further between. And I've had conversations with practitioners who are like, I wish I could spend time talking to you.
Wow.
I wish I could spend time to hear you as a person and help you through this process. And to be honest with you, I think that's very sad. I think it's very sad that we've lost that ability or lost that resource. Now, it doesn't mean that we're going there, right, to speak and be heard for hours, right? It's not like you need, you know, years or months or a day or even a day, right? And this is not about our ego. This is just about us as patients who are actually taking the time out of our day or work, right? Not getting paid, or, you know, annoying colleagues for being ill, or, you know, school, you know, having to take time out of our role in society to go and seek help. And 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 I think we need to honor people in that respect.
I love it. That's completely beautiful. We've got a lot happening. I've been in the moment with you, but I'm sensing chat and I see a hand up as well. So this is a natural pause, I suppose. So Craig, you've got your hand up. Do you want to speak? And then I see Trish and a couple more comments from Jenny. So yeah, let's do that.
And I'll be succinct as possible. So Emilios, thank you so much for your thoughts and your expression. It's really blessing me is the word that I'll use. And one of the things that kind of emerged in the chat is, based on what you were saying, is that we have national sickness services, UK, US, and right? But the young man who you spoke to is really asking for a national wellness service. Now, I think we know that it might be a couple of generations, like maybe my grandson or my great-grandson, before we as populations of nations bring that to fruition. But today, what are your thoughts about what are the parallel infrastructures, systems that can be developed alongside the National Health Service, the National Sickness Service, that helps us to begin to emerge and experiment with a national wellness service.
Yeah, yeah, absolutely. And I think I don't know if I mentioned, but it really blew that young person's mind that there wasn't a point of wellness contact. There was no wellness, channel. They were like, really? Is it all about, does my leg have to have fallen off before I can, legitimately access this thing called the NHS? And I mean, look, as an innovator, as someone who's an entrepreneur, who's been involved in the health care and wellness scene, and I've participated in various different ways, to certain, positively and not positively. It has, I think we're waiting and we're allowing the private sector to do that. As simple as. And I think that's an approach NHS England has taken with things that are outside of its remit and outside its financial budgetary control. And you speak with the North American accent. I'm making assumptions here, but
yeah, I'm in the United States. Yes.
I think having spent some time in the States as well and seen the healthcare system there, I think there's a financial incentive for healthcare practitioners as well in order to maintain sickness in some way. There's the perverse incentive. There's a perverse incentive. And I was watching a YouTube video, and it was an American doctor who was talking about the condition that that I'm going through. And they were talking about the number of different nutritional supplements that you could take to try and treat this problem. And I swear, there must have been about 20 different nutritional supplements she was advising, all from the same brand and obviously some kind of advertising thing. And I was going, oh my God, I can't believe she's recommended this, and then this, and in the morning take that, and in the evening take that, and then when you're asleep, wake up and take this one. I'm like, what person is going to take these supplements, and how can they afford them?
Right. Yeah.
Right. How can they afford them?
Yeah. So it's quite interesting as you were speaking, to envision. So when I've traveled to China, and it was explained to me that the traditional thought about healthcare is that doctors get paid as long as I'm well. If I get sick, then I stop
Yes.
paying them.
Yeah, yeah.
And I
Yeah,
remember
yeah.
blowing my mind, right? Like, and so may we have a future, and may we be constantly working on a future where it's about wellness, and the system's goal is to be profitable both socially and financially because people are well, not only if they're sick, because that's very
Yes.
much the system now. Is even investors are you get these perverse discussions that we won't get into now. I think everyone knows what I'm talking about. But obviously, we're here to work on a different paradigm and a different future as far as
Yes.
mental health goes. Thank you for that.
Look, yeah, and to link it to what Rachel was talking about, if we have dancing, street dancing as the intervention, and let's say it's amazing, right? But let's say there's no business model around it, right? Or it doesn't make that much money because it's free, right? Right? Because it's free. You can listen to a tune at home, you can put a YouTube video on and you can dance with them or to it or whatever. Let's say it's free. No one's going to touch it, right? No one's going to touch it, even if it's got the best outcomes. They'll only touch it if there's an intellectual property there, or there's some other way of making it linked to a financial outcome for some people. Now, and that's not me being cynical,
Yeah.
I think that's me being realistic.
Yeah, but even as you said it, I was pondering, and this will make for good research. What are the models that we see in society where people engage with that activity or community where there is not a commercial motivation? And if we can identify those models and mimic them, they're usually based on some sort of connection or community where we do it
100%.
voluntarily regardless, and we don't need an investor. We're the investors. Those are the models to find and mimic. And then I know John wants to say something.
Yeah, I was just going to say we've got just under 8 minutes left. So we've got a couple comments from Jenny talking about the mental stamina of having to prove or that there's something there. So that just resonates with what Emilios was saying. Trish, well, we'll come to you in a second, but John just had his hand up. So yeah, go ahead, John. And then Trish, if you'd like to speak to your comment about dignity-centered healthcare.
Yeah, thank you so much. And Emilios, good luck with your recovery journey. And I'm a psychiatrist myself. You know,
Thank you.
the talking here is great, and I think a great example for us. We need more brave spaces. People talk about safe spaces, but I think we need to, as clinicians and people who work in healthcare system, have a bit of brave.
Yeah, totally.
So 75% of mental health problems are established by the age of 24. So the young gentleman you just spoke about, reaching out for how do I prevent things from getting to the point where I need to use healthcare services is such an important point. And I think the reality is we are in a society where we have an aging population. Healthcare is expensive, whether it's state-funded or private. And one of the things I think we need to get away from, and I'm talking a little bit about this later in my talk about co-production, is it takes a community to keep somebody well, not just a healthcare system. And I think to allow our communities to shape how our healthcare services look like, and how the prevention of either physical or mental health needs to be integrated. It can't just be looking at one lens. And I think there's something here about also moving away from targets and looking at outcomes. So, you know, if people were paid, and whether it's private or the NHS, if the funding followed outcomes, in other words, patient experience, and you were saying earlier about keeping well, if we followed outcomes, which is much more public governance rather than public management, which was brought in the 80s and 90s, if we actually reshaped that whole debate to look at outcomes, I think you'd see a completely different, everybody would have to change the way healthcare is delivered. And I'd welcome continuing that discussion, but I think prevention has to be part of it, and prevention is political. It's not just healthcare. It is actually the way we shape our societies that are making us ill. And there is something of everybody in it. We have a new government in the UK, and they have been listening. If I hear the language about prevention, so I'm hopeful that with that new focus on prevention, we're gonna get some.
No, I think I've spoken with people that have got outcomes-based startups, medical startups, and I think that model is really interesting. I haven't seen them in practice yet, but I think commissioners are looking at that and thinking about that. I really believe it's an experiment worth running, right? And seeing how it goes. I think in terms of community and patient involvement, so, you know, and I'm someone who was patient and public involvement lead for CAMS for several years in my trust. So I reached out to the PAL service at the hospital that I'm working at, and thankfully I got through to someone. Thankfully, that person escalated my concerns to the team I had concerns with, and they might be changing their practice because of some of the feedback that I've been given. You know, fingers crossed, they are listening to it, and I'm having a dialogue with them, which I think is, you know, that I think is great. But I think the thing that I hear from people so often is this sense of community erosion, and that has happened, and I'd say over the last 10, 15 years, more so. I think it's been accelerated personally. And I don't know how that, I think that links to a certain degree with the rise of social media use and the internet as well in various different ways. But, and when I say community, I mean actual people next to you that you can touch or shout at, or you know, they can hear you and you live with them or with and around them. And this is not to denigrate social networks online and stuff like that. You know, I think they're additive, but we need to still maintain those networks and social communities around us. But I sense very strongly, and in various different communities and cultures, that sense of community has been denigrated and broken, and there's a loss. We have lost something, and we need to start looking at what that thing is. And as a practitioner, I think that thing has created partly the rise in children's mental health that we're seeing, or not partly, strongly contributed to the rise in children's mental health that we're seeing on our doorsteps, in our clinics. And it affects us as well, and it affects the way, you know, we see each other, consider each other in a clinical context.